Hi, I'm Ruth Hanston, and I'd like to talk to you today about Step 5 of the 10 steps of relationship and results-oriented healthcare. I know that you've developed your own individualized ways of creating the best healing encounter with your patients, and we'd like to hear about some of those ways that you've developed. We'd like to talk also about 4 expert practices that help patients and families feel like they're cared for and to help them really achieve the results that they want to from the episode of care, both short-term and long-term goals. So today let's talk about 4 specific points to help you develop the best authentic connection with your patients and families. First of all, I'd like to talk about preparation and presence. We know that it's very hectic and you're working very hard, and so sometimes it's difficult to remember to take that deep breath, gel in and gel out, and really spend some time relating to the information that you received in your shift report about the patient, and to really be prepared to be present and connected and authentic with your patient. So the first important point was the 2 P's of preparation and presence. So choosing to care. Secondarily is empathy at eye level. So 2 E's, empathy at eye level. To really connect with the patient, to be empathetic to whatever their situation is, and to be at eye level so that there's not a power differential with you and your patient and family. So number 1 step was preparation and presence. Number 2 is empathy at eye level. Thirdly is that outcomes orientation, or 2 O's in this case. So that as you're talking with your patient at eye level, that you really ask them about what's on their mind, what their priorities are, what their most important needs are, and what results they're looking for. What is most important during this next 8 or 12 hours or throughout this episode of care from a short-term and a long-term goal perspective. We know that sometimes people ask their patients about goals, but that's pretty higher level thinking when you're in pain and you're in the hospital and really ill. So, priorities, outcomes, what's really on your mind, what's getting in the way of you getting well, those kinds of questions help people really have an outcomes orientation. So first of all, we had preparation, presence. Number 2 was empathy at eye level. Number 3 is an outcomes orientation. And number 4 is a personalized plan. So when you're discussing with your patient those results that they're trying to achieve and what's most important to them, that you're able to really look at what is a plan that will work for them. And once that discussion has been accomplished, then you're able to really take that information and share that information with the other members of the healthcare team, both the interdisciplinary team members as well as the members of the bedside care team. For example, your care partners and other affiliated disciplines. So today we've talked about Step 5, the fundamental step of knowing what's most important to your patient and their family. And that step, Step 5, includes these 4 expert practices: preparation and presence, empathy at eye level, the outcomes orientation, and that personalized plan of care. So thank you for joining us and discussing with us Step 5 of relationship and results-oriented healthcare.